My name is Lisa Cooper. I'm founder and director of the Johns Hopkins Center for Health Equity and the Bloomberg Distinguished Professor of Equity in Health and Healthcare at Johns Hopkins. I grew up in a small country called Liberia on the west coast of Africa, and it's a low-income country. Fortunately for me, my parents were professionals and I had a lot of opportunities, but I saw children around me who didn't have those same opportunities, and I always felt that it was unfair and that everyone deserved to be healthy. And based on that, it's not surprising that I ended up in a career focused on health equity and health disparities. When I started my training in internal medicine, I noticed that people had problems that were not just medical problems. They had other problems, whether it was due to crime going on in their neighborhoods or difficulty getting jobs, being able to afford the food they needed or the medications they were supposed to take, problems that many of us may not have ever encountered ourselves. And when I started doing research on health disparities, people were actually not really testing solutions at that point in time. When it came time to start looking at solutions, I borrowed from public health this whole idea of community health workers and sort of brought that into the medical world. The lived experiences of community health workers is so pivotal. They actually know what the solutions are most of the time. And so for research on community health workers, it certainly makes sense to have them share their own story. And that's why we did the photo voice study, is because we really wanted people to see through the eyes of community health workers what it's like to live in their neighborhoods and to navigate those challenges. We had this wonderful opportunity to collaborate with an artist and to make this available outside of healthcare.
What could happen between a collaboration with a doctor and an artist? Several years later, here we have this beautiful workers' monument, which really came into existence through my relationship and friendship with Dr. Lisa Cooper.
And we were talking about how she uses her art to elevate the voices of people who have been marginalized, and how I use my science and my research to do similar things. It's a story of how each individual came to want to bring about change in their community for the better.
My name is Chidima Ibe, and I'm an assistant professor at Johns Hopkins University. I always wanted to do work that brought people into the research process itself as collaborators and not just subjects, particularly racially and ethnically marginalized communities. As a first-generation American, my parents are from Nigeria, and as I was growing up, I noticed that immigrants tend to come together and work in communities to support each other. And so I was always really intrigued by this idea of community. I first got introduced to community health workers right after I graduated from college, and I just fell in love with the whole model. And I remember thinking, this is exactly what I want to devote my career to doing. And a lot of the research that I focus on is the role that community health workers play in helping people become healthy and maintain their health over the course of their lives. I've had the privilege of working with community health workers for over 20 years now. Over that time, I've also learned the importance of focusing on CHWs themselves, because they are not just a means to an end, the end being you reduce disparities, you improve health, all of those kinds of things. They're also worthy of being respected, of being uplifted. They're worthy actually of also even being the focus of research themselves. What working with Dr. Cooper has done is it's affirmed that the way that I want to do things can be done in a manner that is scientifically rigorous and impactful for the communities that are the primary focus of my research.
I never would have thought all those years ago that we would get to a point where we would be able to have a video and an exhibit about community health workers and a whole program of research that uplifts them and centers them. It's like a dream come true.
It really is for me too. So yeah, I'm paying you forward.
Yeah, I'm trying to do that too.
I know, I'm proud of you.
Oh, thank you.